Good morning, New York City, the United States, and everyone joining us around the world via live stream on hot97.com and our free Hot 97 app. It's Sunday, April 5th, 2020. I'm your host, Lisa Evers, and I'm so glad you're joining us for the special 2-hour live broadcast from our Hot 97 studios in New York City, the epicenter right now of the COVID-19 pandemic in the United States. Now, while some people are still, incredibly enough, in denial about the seriousness of this crisis, the reality is spelled out in the numbers, which are devastating. As of last night, there were more than 113,000 cases in New York State, and more than 3,500 people have died. One of those deaths was the mother of Scott Stringer, the New York City comptroller, and our condolences to him and his family. So nearly 16,000 people right now in New York State are in the hospital, and 10,000 patients with coronavirus have been discharged. So people are recovering. Some people are dying. Some people are recovering. Some people are just hanging on for their lives right now and fighting for their lives. New Jersey has more than 29,000 cases. That's bigger than some of the towns in New Jersey, and over 600 deaths. Connecticut, nearly 5,000 cases with just over 130 deaths. Both Governor Cuomo and White House coronavirus response coordinator, Dr. Deborah Birx, they expect the peak to hit in the next 7 days. They're even saying here in New York City, we could be hitting the peak, and we're going to find out in a minute what that really means, within the next 4 to 6 days. This is when the contagious aspect of the coronavirus epidemic is the most deadly. And we're going to find out what we can do to protect ourselves. Now, while frontline workers, healthcare and hospital staff, paramedics and EMTs, and U.S. Army National Guard continue to struggle with critical safety supply shortages, they do their jobs, and we thank you for that. Help is on the way. The NBA is donating 1 million surgical masks to essential workers, thanks to the Knicks and the Nets and the Chinese Consul General. Nets owner Joe Tsai donated 2,000 ventilators, and Governor Cuomo says the Chinese government is sending 1,000 ventilators this weekend. 85,000 people have volunteered to help in the crisis. Governor Cuomo says 85,000 volunteers here in New York State, including 22,000 from out of state who have come here specifically just to help us out at this time. So we appreciate the sacrifices all of you are making to come here and help us out. But this is far from over, and as we been told by Mayor de Blasio and both Governor Cuomo and Governor Murphy in New Jersey, the worst is yet to come. More stores are closing. That's one of the things I noticed yesterday when we finished the show and I was heading home. I saw many more stores that I had seen on the way home that were open last Saturday. They were closed. And that's making it tougher for people. That's meaning longer lines at some of the stores that are open. Our first responders are suffering tremendous strain. We want to keep that in mind and keep them in our prayers. Under the heavy volume of people asking for help, our emergency 911 operators are taking thousands more calls every day. Our FDNY paramedics and EMTs are making nonstop runs to people in distress, trying desperately to save lives, doing 16-hour shifts, getting a couple hours sleep and then back at it again. The NYPD is trying to do their job with nearly 20% of their members out sick. So everybody is pulling extra hours, doing extra duty, and we thank everybody that's out there doing that. The last 2 days, we've seen about 12 people an hour in New York City die due to the coronavirus, and that is expected to get worse over the next week. It's just so depressing just even talking about this. Remember, every one of those numbers, that's a human being. That's somebody's mother, that's somebody's father, that's somebody's son, somebody's daughter, somebody's loved one, a neighbor. It's like the ripple effect of this, we can't even begin to estimate, for a very, very long time. So in spite of this depressing picture, though, there are many people who do survive. As I said, 10,000 people discharged after being hospitalized for coronavirus here in New York State. But we can all do our part to slow the spread of this highly contagious virus, especially going into this most dangerous period. We're taking your phone calls now at 1-800-223-9797. That's 1-800-223-9797. And on my Instagram and Facebook pages, at Lisa Evers, with that blue check mark, you can leave us your questions and comments. We're joined in studio by Dr. Emmanuel Manny Fambu. He's a medical doctor with an MB and MBA and author of the best-selling book, The Future of Healthcare, a medical medical futurist and a medical expert. He's also advising some of the key policymakers at the forefront of the coronavirus response and how we're dealing with the pandemic. Dr. Manny, thank you so much for joining us this morning. We appreciate it.
Thanks for having me, Lisa.
So when you hear these new numbers and they keep going up and up and up, and then Governor Cuomo saying we could be hitting the worst in the next 4 to 6 days, how do you assess that? What does that really mean?
I know it's scary for everyone, but there's always light at the end of the tunnel. Just like you mentioned earlier, most people that get infected do survive, right? They don't die.
And that's still the case?
That's still the case, and I think that'll continue to be the case. As we know, the people that have low immune systems, have other comorbid conditions, elderly at higher risk. That's why we keep pushing on people should stay home and make sure we can keep those people safe.
Now, the big message that we got yesterday from the governor and from the mayor as well, it's really a story of volunteers and ventilators. They need people to work in these frontline healthcare jobs, and then they also need ventilators. When the governor says this apex or the peak is coming in 4 to 6 days, does that mean what does that really mean? Basically?
It means that from forecasting and predictions, we think that the worst case scenario or the tipping point, the highest number of infections, if everything else is controlled, will be next week.
So does that mean that that's also in terms of catching it or being exposed to it, that's going to be the riskiest week numerically?
It just means that the number of people that they can predict actually are carriers and those that get infected. If everyone stays at home, just like everyone's been told to stay home,
right,
then it can be controlled to that point. It doesn't mean that if we break those rules, that the numbers will not spike again. You see, if everything is controlled, there'll be a point where we'll have a maximum number of people that are infected, and then hopefully we have fewer new infections.
And then in terms of who's getting it, I ask you this every time you come on the show, and thank you for being with us again and sharing all your knowledge with us. In terms of who's getting it, who do we know? Is it too soon to tell? Because right now they're just basically trying to save lives, right? But do we know anything?
Correct. So anyone can get it, like we said, right? So anyone can be a carrier of this, right? The question becomes who gets sick, and there are people that have had it that actually recovered. There are those that get it and then proceed over to have more severe disease, pneumonia, that end up needing ventilators. But a very interesting point here to think about it is if you live in New York City in any of the boroughs, for example, if you're in Manhattan, definitely people that have the median income is much higher than if you live in the Bronx or you live in other parts of the city, okay? And what we are finding out is, and a lot of publications now, a lot of data that supports this is when we talk about people should stay home and we talk about some of those essential workers, who are those workers? Workers that work in grocery stores, right? You have your supers, right? You have your janitors. They have to clean everything else. They have to make sure we survive. Gas station attendants, grocery store.
Most interaction with the public.
Correct. Most interacting with the public. Those people are not making over $120,000 a year, right? So these people live in poorer communities that in general were being affected with chronic conditions, medical conditions, diabetes, asthma, some of those things we talked about. Just in the Bronx, for example, if you look at the Bronx, the death rate in the Bronx is 3 times higher than that of Manhattan.
The death rate in the Bronx 3 times higher than Manhattan.
Correct. And in the Bronx, even before this whole COVID-19 pandemic, if you look at the rates of hospitalizations for asthma, right, they were significantly higher. Bronx had the highest readmissions in the hospital for asthma than any other county in New York.
Right, and I think one of the highest in the country, too, especially in the South Bronx there.
Correct. And so those people in those particular areas don't have the luxury of taking time off work. They have to go to work, right? So they're taking public transportation.
Or they don't eat, right?
Correct, or they don't eat. And so those people are being exposed a lot more. And when they come back home, people don't have the luxury of having basements in their apartments, right? People are living in apartments, multiple people, and someone has to go out and work for everyone to survive.
And this is the thing this is the whole point that we've been making on the show too, is that people in the city, when they talk about, if you're not feeling well, you should isolate yourself and all of that. That's easy to do if you have a house that has a basement and that has an extra room, or you have, separate bedrooms for every single person that's in that household. And there's a lot of households here in New York City that don't have that.
Correct. And when we expect these people to go to work, and guess what? They don't even have protective equipment to actually protect them from going to, right? And so they're going to work, exposing themselves, coming back, taking the train stations, going back to communities that already had, pre-existing conditions and massive chronic problems with disease. And they have very poor healthcare systems to actually manage them. I think in the Bronx, actually, it's very difficult to actually find a testing center even within the Bronx itself.
Right, and there was one testing center. I posted a picture on my Instagram page. It was a testing center in the Bronx. The National Guard that was dealing with the public, telling them where to go. They were in cars, of course, but telling them where to go. They didn't have masks. They didn't have protective gear. Some of the workers, just the civilian staff who were there directing people, talking to them, pretty close up in the window of the car, through the window, with the window of the car rolled down. They didn't have a mask. They didn't have gloves. They didn't have anything.
Correct, and that's actually even scarier. Last night I was actually watching a video of the Javits Center. I look at the number of hospital rooms that they actually built there. Massive, right? Hundreds and hundreds. And I was thinking, who is going to work in each one of those rooms, right? I mean, if you show up, we don't have an increase in thousands of doctors and nurses that are showing up at Javits Center to work, right, to cover the shifts. And those that are working these long shifts, like you mentioned, 16 hours. The longer you work, the more prone you are to making errors, right? And so...
True.
Correct. So the issue here is intense capacity beyond what our health system can handle. That's the problem. And
then also Governor Cuomo, they're allowing the medical students who were about to graduate, this June or this term, allowing them to start working because they're so desperate for people.
Correct. And people are working long hours. Even before this, healthcare workers had burnout issues, right? Suicide rates and mental health rates were very high in the healthcare, especially population, right? As a doctor, I'll tell you that many physicians actually, the suicide rates among doctors is very high. Burnout rates are very high because they're being overworked. And so imagine that in this particular crisis. Yes, they're doing their best to actually cover the shifts, but people are getting sick. People are getting infected. People are taking days off. Someone needs to cover those shifts, right? So it's insane.
And they've been going hard for weeks now here in New York.
Correct. And it's going to get worse.
So in terms of this, in terms of going into this peak period now, as Governor Cuomo says, do we have, we keep hearing about these ventilators. Is part of that politics where they have to keep asking for them just to keep the pressure on and keep the word out there so that some of these multimillionaires like the owner of the Nets and, Robert Kraft and people will just do what they can to pitch in?
It is one of those things where we all have to work together as a community, right? No one, politics aside, I don't think anyone was expecting this kind of thing to happen, right? So no one had thousands and thousands of ventilators on the side waiting, right, to get in. You probably have very few manufacturers of ventilators. But for what I've heard recently, that other companies in the country are actually stepping up, and we are trying to get our hands on as much ventilators as possible.
All right, 1-800-223-9797. That's 1-800-223-9797. Give us a call. Let us know how this whole coronavirus pandemic is affecting you and your family. 1-800-223-9797. Dr. Manny, let's take a call right now. Let's go to Lisa. Lisa, hi, you're on Hot 97 with Lisa Evers and Dr. Manny. Go right ahead.
Hi, Lisa Evans. I'm concerned. One of my friends was sick, and they work in the hospital, and they told go home, stay there for 7 days, and then go back to work. So I'm confused. So if you're sick, then you go back to work? I don't understand that.
Was your coworker, were they given a test, a COVID test?
No, she said she had a fever, she was coughing, so we confused, how you go back to work if you have the virus? I don't understand that.
What about that, Dr. Manny? Well, first of all, she doesn't know if that's the virus or that's the flu or whatever, right?
Correct. I mean, I think right now it's a very concerning period. Like on my way here, this morning, if I see someone sneeze or cough, the first thing is that COVID-19
Stand back,
or coronavirus,
right?
So it's a normal instinct for people to have.
Especially this time of year. We're going into allergy season, right?
Correct. Yes. So I will hopefully trust that if she was not feeling well, it's not COVID-19, maybe it's fatigue. There are many reasons why people will cough and sneeze and have fevers, right? It doesn't mean you have coronavirus,
right?
If you have a fever, but I understand the high concern. Yes, exactly. So I will consider that a high risk until proven otherwise. So in that particular case, I think someone like that should be tested because they're high risk. They're a healthcare worker in the forefront. The front line, so they should be tested and then ruled out, then go back because everyone should be concerned.
Some of the smaller states where this hasn't hit in as devastating a way as what the Dr. Deborah Burke says are the hot spots: New York, Louisiana, Detroit. Some of these smaller states, they're testing doctors every single day. They're getting a COVID-19 test to make sure before they even see patients.
Correct.
We don't have that luxury, though, right now.
There should be absolutely no reason why New York City should not be testing its frontline workers. Absolutely no reason. Because think about it. It's not just about, one, if they get infected and they get sick, then they can't take care of patients, right? And we know the numbers are going to increase, and we need these people to be there. Second of all, this this frontline workers have to go back home to their own families. I've seen cases where clinicians are actually going back home and staying in tents outside of their own homes because they're worried about getting their family sick. Right? That's not acceptable.
No, that isn't acceptable. 1-800-223-9797. That's 1-800-223-9797. And one of the fastest growing areas, Dr. Manny, as you know, is Long Island. They're getting hit with a really big wave of coronavirus cases and a lot of tragedies happening out there and a lot of health workers doing the best that they can. Let's go right now to Waylyn Hobbs Jr. He's the Village of Hempstead trustee on Long Island, and he's trying to deal with people that just don't think they need to stay inside or stay home. Waylyn, thank you so much for joining me and Dr. Manny.
Good morning. Thank you for having me.
Good morning. Now, you're very concerned. Tell us what's happening in Long Island, because just from friends and work colleagues and coworkers, I'm getting, people are saying, oh, now we're starting to hear about this neighbor or this person at this particular store or at this, part of our church group or whatever who's being affected. What do you see happening in Hempstead there in your village?
Well, here in Hempstead Village, last month, March the 18th, we had 14 people that tested positive. As of today, we have over 300, and this is just in the village of Hempstead. And so we're concerned about the growing numbers. I've also noticed that people are not just following the rules as far as social distancing. We still have people that's hanging out on the streets, gathering together. We've closed our parks inside and outside, but we still need our residents to just follow the rules because they can slow down the spread of this virus.
And Waylyn, in terms of getting the message out, have you seen, and also too, you're dealing with a lot of people, you're talking with a lot of people, a lot of the functions from the, of the village itself and in the county there. What are you hearing from residents? Are they really concerned about this, or do they think this is more like a New York City problem? What kind of attitudes are you coming across?
Well, we have quite a few of our residents that they are taking this serious, but we don't have enough of our residents taking it serious. I rode around just the other day, and again, there's certain areas in the village of Hempstead that we see people just gathering and congregating in the street. And my message to them is, listen, although you may be asymptomatic, you don't feel any symptoms, no fever, if you don't do it for yourself, do it for your parents, do it for your grandparents, do it for people that this virus can really be devastating. And so that's the message we're trying to give to our residents. Please, let's keep social distancing. If you're outside, of course, don't put your hands in your face and just follow the rules. When you get in the house, wash your hands with soap and water for 20 seconds. If we follow these, we can slow down the spread. And that's the message we're trying to get out to our residents.
And then in terms of the stores, are a lot of the stores still open, or are you guys, are most people following this statewide, emergency and essential services only?
Well, we have allowed our stores to remain open, but only for curbside service. People can still go to the deli and get a sandwich, but they're not allowing people to go inside the store because, of course, even our local bodegas, they do serve breakfast and people still have to eat. So we're making sure that they keep the social distance. At the same time, our businesses are able to continue to operate without having people inside.
And then if you see large groups of people hanging around together, or just people, especially if we haven't had a long streak of warm weather, but what's going to happen when it gets really warm. People are just going to find it difficult to resist the urge to go outside. Do you plan any type of enforcement? Like New York City, they're doing fines of $250 to $500. They're threatening that if people don't stop congregating. Anything like that going on in Hempstead?
Well, we're going to look at that option. If we still have people that's congregating, then we will start issuing summonses to these residents. But at the same time, our police department is inundated with calls for people with high fevers and people that's sick. And so we're praying that our residents would just listen. So, again, that we don't overtax our police officers, because now we have to have officers enforcing that when they can be helping our residents.
Exactly, and being there for them. And Dr. Manny, in terms of the advice, anything new with the essential workers? Because I have to say, yesterday when we finished the show and I was going out, did a couple errands on the way home, essential errands, and went back home. I saw a lot of people, pretty much, I would say the vast majority were wearing masks.
Correct. So people are using their own personal money to buy, face mask and buy gloves and all that, right? People are looking for anywhere you could possibly find this. Just recently, even looking at online, if you try to buy, like a face mask or gloves from Amazon actually puts in like a warning to let you know, hey, these are reserved, for healthcare workers. So,
Right.
so I think the community is all coming together to make this happen. But I think the governor and the mayors, everyone is trying hard to make sure we have all the healthcare workers have exactly what they need.
Let's go right now to Daryl. Daryl, hi, you're on Hot 97. Go right ahead.
Hello.
Hi, Daryl. Good morning. You're on Hot 97. Go right ahead.
Good morning. I just wanted to call in and speak about people in relationships and being stuck, quarantining in the house and stuff like that, with your loved ones. And, it's a rough time for people who have mental health problems and they can't go out to reach the proper channels they need to get the support. And this is I've seen me and a few of my friends go through this issue. And it's just like a really troubling time right now.
No, Daryl, it is a really troubling time, and this for next weekend we're going to have more on the mental health and what services are available for that, because especially when you're confined inside too, like if you're, which we are, we're stuck inside our apartments and our homes, and then no matter how many shows you watch or how many times you clean the house or whatever you're doing, or teaching your kids or, doing your work, working from home or whatever, it's still being in that one space all the time. Your mind can start to play tricks on you. It can start to just really distort things and distort reality and exaggerate it. But we'll find out what kind of mental health resources are available for that. What kinds of things are you going through?
It's a lot of displaciveness, like you were saying, people just replacing what they want with the facts, opposed to being what is the facts.
No, exactly. Well, that's why we're doing the show, and thank you very much for calling in. Let's go to Dennis right now. Dennis, hi, you're on Hot 97. Go right ahead.
Hi, Lisa. I just wanted to make a comment that nothing helps more than your very specific details and statistics. They are extremely helpful to be able to grasp the magnitude of what's happening.
Oh, well, Dennis, thank you very much. I appreciate that. We're trying
Absolutely. Thank you.
Thank you. And thank you for calling to say that. That's so sweet. I appreciate that.
Absolutely.
Thank you. All right, let's go to Nicholas right now. Nicholas, hi, you're on Hot 97. Go right ahead.
How you doing? My name is Nick, and I'm an essential worker. I work the parks in New Jersey.
Okay.
And unfortunately, people are still out here, and they're going about their business and not really listening to the rules. It's unfortunate to see because me personally, I'm working 7 days a week, filling water tanks and stuff like that in the parks, and it shouldn't really be done because people shouldn't be in the parks, and I'm out here risking my health. I don't get hazard pay. I'm on my base hourly pay. And it's just unfortunate to see people not listening to the rules in New Jersey, and I feel like the governor should take better steps to close the park and make people follow the rules, because essential workers, I don't think they're getting recognition that they should out here. It's unfortunate.
No, Nick, and that's definitely the case. And I think part of it also is they just don't have the people to enforce all this right now. I mean, I'm sure every police department in the tri-state area, in our New York, New Jersey, Connecticut, they're overwhelmed with these calls. They have many of their own members who are sick or who are out, and they're dealing with a lot of health crises too. And to be able to police it is really tough. But are you able to protect yourself?
Yeah, unfortunately, I've been able to find masks and gloves on my own. My company is kind of struggling to find more. They do what they can. I'm not going to lie. My company does try to take care of it. But on the front lines, it's more dog eat dog. Like, if you can find a mask, buy it. But if not, my company's struggling to buy them online. My boss says if I could find some in stores, he'll try to buy them. But any stores you go to, you can't buy bulk. So a lot of the guys out here are wearing the same mask for weeks on end, and I feel like that's just counterintuitive of what we should be doing.
Let me ask Dr. Manny about the mask. Nick, stay strong, stay healthy, and thank you for what you're doing. And let's ask Dr. Manny about these masks. That's the other issue, too. People think it's like you get one mask and then, boom, that's it. It's my favorite pair of shoes. I can wear them, or sneakers. I can wear them every day. Do you have to wash it? What should you be doing?
Of course, because that mask could actually get you sick, right? If you imagine, remember, a mask is just like another surface, right? The mask is not like some kind of medication that kills viruses that comes to it, right? It's a barrier. So you think about it as if you have on underwear or you have on clothes in general, right? Would you want to change them? Of course you want to change them or wash them. So now it depends on the fabric that is used to make it, right? If you have something made out of paper, of course you can wash it, right? But it's better than nothing. But you should remember that even if you put it on a surface, that mask can get contaminated and get infected, and then you might go touch it and then put it back on your face and actually put you in a worse situation. So it is important that we have access to this protective equipment.
So let me ask you this, and shout out to at Lola's mommy, who sent me a video of how to make a mask out of bandana and rubber bands, of how you fold it and then how you put the rubber bands in so that you can put it around your ears, which obviously a piece of cloth is a lot easier to wash. Is that helpful since people can't get these regular surgical masks now? And
yes, the recommendation even from the president is even if you have a scarf, you can put it across your face. It's not as effective as an N95 mask, but it's better than nothing, right? So we are at a point where we are doing whatever it is to help protect ourselves. And this goes beyond what the caller talked about going to the store and trying to find things and is a dog world. The same thing is happening on the state and federal level, right? We had discussions about states actually fighting to buy the same mask.
Right, and that's what the governor was saying too. It's basically like an eBay type of situation for ventilators, masks, all this medical equipment.
Correct, even on the government level, right? And so this happened on every single level, which would be much easier if we just say, listen, let's just get a bunch of masks and just give it out to people. Why should a frontline worker be spending their own cash and they're not being paid extra to do this, by the way?
Exactly.
Right, there's no extra pay or there's no hazard pay for this.
Exactly.
So they're working longer hours, getting the same pay. This is a time where someone delivers food. You want to give them an extra tip to thank him for being out there.
That's what I've been doing. Right.
Yeah, correct. To help support all these essential workers that are out there.
Thank you so much.
Correct. The grocery store workers, all these people are coming out every single day, risking their lives for us.
Right. The guy at Health and Harmony, a big shout out to them. Everything he was running up on the cash register is a thank you.
Correct.
You have everything. The store was fully stocked, which was it's so exciting now when you see shelves that have things on them, what you're looking for. But anyway, let's try to take one more call real quick. Tony, hi, you're on Hot 97. Go right ahead.
Hello, Tony. Hello, Lisa.
Yeah, Tony, how you doing?
Yes, hi. I have two questions. The first question is, when the ventilators are coming to Suffolk County, New York, Long Island? And my second question is, it was more prior to the other guy from Jersey. He was talking about he works in the park.
Okay.
Yeah, the state parks out here in Long Island, they are like super packed. Nobody's wearing masks. I see maybe 2% of people in the park wearing masks. Everybody's not doing social distancing. I understand it's nowhere to go. A lot of these small businesses are they open, but you can't go there to sit down and eat and nothing like that. But describing what he was saying is how everybody's going to the park to walk and everything. Believe me, they're super packed and no one's doing the social. It's going to get really worse out here in Suffolk County, New York.
Well, let me find out. Go ahead. I'm sorry.
No, I'm just saying, just because the where it's going, its possibility is going to really get even worse.
There've been major grocery stores. In major grocery stores on Long Island already, Trader Joe's had to shut down because of workers that tested positive for COVID-19. They did deep cleanings and then they reopened some of the stores. Some of the other chain stores have had numerous workers. They've had to shut down. The hospitals are already, just starting to get really, really rammed out. But in terms of the ventilators, it's the ventilators. They're basically the front line is really New York City right now.
No, it is. And to add to that, the park situation, when that question is being asked about this, this next week is going to be our peak, right? We talked about this at the beginning of the show, and that's based on the idea of everyone following the rules based on what we know today, right? When we hear things like this happening, in Long Island, right? Or I'm sure in the city as well, you might probably find some
Totally.
places.
People
Correct.
were the farmer's market, people on the street that they shut the street down for. I drove past, I was going like, are you kidding me?
Correct. People go to the farmers market. People are playing basketball still with each
Right,
other, right?
right.
In specific neighborhoods. People don't care about this. That's exactly the reason why this will not stop in a time frame that we expect it to stop. So if you ask, when are we going to get back to normal?
Yes.
We don't know because of things like this, right? Because we can't control for this. Because everyone
So
is
we
supposed
can't
to be
really
home.
say. So you guys can't really say right now.
No, correct.
All the medical experts.
Correct, because you're assuming that everyone is home, and so at everyone that's infected, you already know. And so when you have people not following the rules, then it's very hard to actually estimate any single thing. With the ventilators, for that question of ventilators, we know that the city's under high pressure right now, right? We don't have enough in the city. But the governor has talked about if it's necessary to take ventilators from some other hospitals in upstate, right, to make sure they're available in the city. So for now, where it goes within the city, I think that's left for the medical ops people to figure out what to do with that. But rest assured that they're doing the best they can.
Let's go to Britt. Britt, hi, you're on Hot 97. Go right ahead.
Hello, my name is Brittany. I'm a registered nurse working in a designated COVID unit. I just wanted to point out that, people are saying you need to think about your grandparents, you need to think about your parents, you need to think about your nieces, your nephews, your cousins, because this virus affects all ages. I have somebody who's a teenager fighting for their life right now, so we need to think about everybody, not just the older people, because it affects everybody.
And Brittany, first of all, thank you so much for what you're doing and the work that you're doing trying to save lives. How are you doing? And what are the nurses? Tell us what the nurses are going through right now.
Honestly, it's rough. It is like a war zone. I actually just got off work. I work overnight. Getting a little emotional talking about it.
That's okay. Take your time. People need to understand how real this is.
Yeah, mentally, it's taking a toll. Thank God right now I do have enough to protect myself, but I had to go out and purchase that on my own because it's so limited at my facility. And it doesn't look like it's going to get any better at this point. It's going to get worse, and people need to really realize and stay inside and keep themselves safe.
And what has been the toughest part of what you're doing right now?
The toughest part is watching people die alone, because people don't realize that when you're in the hospital right now, nobody can come and see you. You can't have, if your grandfather's dying, you can't be at the bedside. If your sister's dying, you can't be there. I had a patient die, and their family was out the door. They couldn't come in and be with them. And there's no funeral. There's nothing afterwards. Like, these people are just being put in body bags and shipped out, and they're alone. And I think that's the hardest part for me, is just watching these patients. And it's not even like I can be in there and hold somebody's hand, because I have, not other patients to attend to as well. So it's like I feel guilty sometimes that I can't be there, and they're gone, and they have nobody. And it's just like I have to suck it up. And it sounds sad to say and kind of rough to say, but it's like I have to worry about now the next person and try to hope and fight for them and not let them get to that point.
Oh my God, Brittany, people need to realize too is like you can't see your loved one when they're in that situation, and you guys are you're the last person that some of these patients are seeing.
Yeah,
and it is real scary.
No visitation whatsoever.
And this is part of the mental health element of this, right? As a nurse or as a frontline worker, you're not trained or ready to go to work and see dead people every single day, right? And so you are seeing mass casualties, and people are going back home to their families, realizing that there are other people that they're working hard, extra as best as they can to save these lives, but they can't. And so when we say, please stay at home and let's help control this virus, it is real. Right, I mean, you literally could hear as
Brittany's saying,
right? I mean, she's literally in tears. So this is not acting. This is real life. She just came out of work. She's been up all night working in this particular case.
Nonstop.
Right?
Brittany, it's been nonstop, right?
It's nonstop.
You barely have a chance to even grab a little something to eat or go to the bathroom, or just it's like go, 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 right?
I did not eat all night. My bladder is very strong because I didn't use the bathroom at all.
Oh my God! Well, I'm
Thank you,
hoping,
Brittany. Thanks for everything that you're doing. And
Brittany, go ahead.
no, please, no. So thank you, Brittany. And I have the utmost respect for every single nurse out there.
You're the son of a nurse.
I'm a son of a nurse.
I'm the daughter of a nurse. Okay.
Correct, right? And I was trained by nurses, so right. So I really, really, really do appreciate everything you do. And I mean, this is the best we can do, and I think you're doing the best you could possibly handle. Just stay strong, please.
Okay, Brittany, I'm going to ask you to hang on. We're going to put you on hold for a minute, and Anaya's going to talk with you off the air. Okay.
Okay.
All right. Thank you so very much, Dr. Manny. The nurse. I mean, everybody's role in this whole healthcare system is everybody's role is very important, but the nurses have more hands-on with the patients, like nonstop.
Correct. In Brittany's case, to put it in perspective, so if you are in the front lines, you're a grocery store worker, an Uber driver, then you're playing Russian roulette, right? So you don't know who has the disease, it's possible or it's not, right?
She's in the COVID unit.
Yeah, it's 100% guaranteed that person has it, right? And so these symptoms we're talking about, advanced symptoms. This is someone that's taking a test. This is someone with advanced disease, right? This is someone that's probably needs to be on a ventilator. So you necessarily you need to have physical contact with this particular patient. You need to intubate them. You know they're coughing.
Were
right?
you surprised that she said she had a 15-year-old patient?
Oh, no, I'm not surprised. There are many cases of young people being infected today, right? But when it started off, we said those that were at higher risk were the elderly, but we know it affects every single person. There are younger people that also have comorbid conditions. Young people have asthma, young people have cardiovascular disease, so they're also at high risk. So I think it's very important for us to realize that everyone needs to stay home.
All right, let's go to Monique right now. Monique, hi, you're on Hot 97. Go right ahead.
Excuse me. Good morning, everyone.
Good morning.
I want to say much love and respect to all the frontline workers, the nurses, the doctors. Right now I'm a little emotional because I was just listening to Brittany. I work for a mental health agency. I'm a direct support professional. We have to be in direct contact with people who have mental disabilities. Some of them are nonverbal. And pretty much my last day of work was Friday because someone was diagnosed in my house and there was no staff. There was no staff to relieve me. Everyone is walking out, and everyone is scared. And it's like they're asking you to come to work. Unless you have a fever, you should be reporting to work. That's not fair. You know what I mean? Like we don't have the proper mask and the gloves that we have. They're running out. It's like it's a scary feeling. And now these guys, some of them are home. They're counting on us to come into their homes to take care of them, and they're like alone right now. This is like really like a health crisis where people who depend on us can't even get the help because we are not protected. So I just
No, go ahead. No, so you, Monique, so you work with you work with the mentally disabled.
Yes, I'm a direct support professional, and we pretty much work directly with people who have mental disabilities or mobility issues. And a lot of our guys that we support, they're elderly. And someone that I know was diagnosed recently, and he's nonverbal. He didn't have a fever the whole time. We were monitoring his fever, but yet the agency is telling us that we should be coming into work if we're not showing symptoms. It's like, it's really mentally messing with me because I want to be there to support these guys.
Were you tested?
No, I wasn't tested, and I want to say back in December, I had all of these symptoms. I hear a lot of people are saying this. I don't want to get too far off topic, but I've had these same exact symptoms in December of last year. I went to get swabbed. They said I didn't have the flu, but then they gave me flu medication. So I could be someone that, I don't know, asymptomatic or whatever, I don't know, but it's just, I have a young child at home. I have elderly people in my family that, again, if I come into work because I don't have a fever and I'm exposed, it's not fair. It's not fair to everyone. It's just a rough time that I'm trying to keep my wits
correct
with me.
Even the recommendations for someone like you, for example, right? If you've been exposed to someone and you're a healthcare worker that has the virus, you should be tested,
Correct.
right?
Right, but they just don't have enough tests. We keep coming back to that
That's
issue.
the thing.
Correct.
Yeah, so I'm sorry to cut you
But
off.
that's a big challenge, piece, because if you're not testing people, right, and people are going back in the same environments, then you're getting other people sick. You put them at higher risk,
Right.
and the numbers will just keep growing, right? So it's possible that many people I've spoken to that will mention, like, oh, I had the symptoms probably December and January. Yes, we know that the virus has been around since December, right? So we know that. So it's possible people were sick. The first diagnosis in the United States was in January. It doesn't mean no one had it in December, right?
Right, but we don't. But again, it's always the same issue. They don't know what all the medical people, all your medical people, but it's like the medical profession doesn't know the full scope of what they're dealing with because it's hard to, I guess, come up with whatever our commonalities because there's not enough tests to go around.
Correct.
And it takes so long.
Correct, and that's the scary part of this, right? And so the reason I'm bringing this up is because the main question people ask is when do we get back to normal, right? And
Right.
so if we are in the same position where we have healthcare workers that are going to see patients that are vulnerable, and we know that this patient, someone tested positive, and you still have people going to them, and for them to wait till they get fever to get tested, it's counterproductive where we're going, right? So that's the need. Well, we need
Exactly.
rapid testing. We need tests right away in the market. And hopefully very soon with the antibody testing, you'll be able, for example, to find out if in December you were actually infected or not, right? There are many people that will find out, I probably had an infection and I thought it was unknown, right? And so now, can we use your plasma, for example, to help other people? That's what research is being done today.
Exactly. Monique, hang in there, and thank you very much for calling. Next weekend, we're going to have a psychologist on the show talking about some of these issues as well. But thank you very much for being with us. We appreciate it.
Thank you so much, guys. Keep
Hang
up
in
the
there.
good
Keep
work.
up, and you keep up the great work too. All right.
Thank
let's
you.
go to Rodney right now. Rodney, hi. You're on Hot 97. Go right ahead.
Hi, Lisa.
How are you? Can you, Rodney,
Okay.
turn the radio down in the background, please?
Yeah, sure. Well, I have two questions for you.
Okay.
How come President Trump don't have a mask on when he talks? I've seen him on TV. And where could I get a mask? I can't afford a mask because I'm disabled. And I can't afford a mask, but I try to cover my face as much as possible.
Well, Dr. Manny says that's very good. Even if you cover your face with a scarf.
Correct. Any kind of cloth, and I mean that's the best we could do now. If you can afford a mask, anything is better than nothing, right? But ideally, you should be able to get a mask, which is difficult. So I think we should look up some resources available, for people that can afford masks. There are many organizations out there, people are making masks at home and collecting masks. Someone in your situation being disabled, I think, we definitely try to see how we could get you a mask or something, right, to look up.
Okay, and we're going to try to, I'm going to post on my Facebook.
Correct.
The Lisa Evers official Facebook this afternoon. I'm going to talk to Lola's mom, at Lola's mom. Shout out to her on Instagram, and see if we can repost that Facebook video of how to make a mask out of a bandana, which you could do out of a scarf. Is very easy. I think the bandana is easier because it's cotton, and you can just easily wash it at night, hang it up over the, towel rack, and you're good to go the next day.
Correct. And in the meantime, if you don't have a lot of traffic coming in and out of your home, that would be probably great to stay home. I know it's hard. I mean, I don't know if you have to go out and get groceries, which is difficult as well.
Right.
Right. But having
Totally.
support, I've seen cases where even in neighborhoods where healthy people actually volunteer to help people that are disabled or elderly, right? To help them.
No,
with
there's a
grocery
lot of that
shopping.
going on too, and I want to say that about our communities too. Is, a lot of our communities we know who our neighbors are. We know who the elderly are. We know the people that have home attendants coming into them or whatever. And there's all, there's neighbors helping neighbors in a lot of ways too. And a lot of the more physically able people are helping the ones that usually need assistance to go to the grocery store. And that kind of thing is a beautiful thing. It's like New Yorkers coming together. But listen, we got to really come together this week. We got to really stay home, really cover up. And just really, really pray for everybody, especially you're hearing these frontline workers talking about what they're going through, and just the stress is unimaginable. In addition to the physical exhaustion, you're dealing with that mental stress. Imagine being there watching somebody die without having a loved one there with them, and you can't even touch them or hug them because they're they have this highly contagious disease. And, we've heard stories already of people saying their final goodbye via a FaceTime video with the nurse or the doctor holding that phone so that the person could say goodbye. I mean, that's just absolutely 100% tragic. So, but again, our thoughts and prayers and support to everybody that's trying to help us win this. Let's go to Lisa right now. Lisa, hi, you're on Hot 97. Go right ahead.
Hello?
Hey, Lisa, you're on the air. Go right ahead.
Hi. I just want to comment and say, and say thank you to all the nurses. They're the real heroes. Doctors, they do what they do. But the women and the men in the nursing facilities, they're the ones who carry out all the orders and are there in the true line of fire. The doctors take one look and then that's it. It's from the nurse's job. After that, my mom, she tested positive, and I said goodbye to her a couple of days ago. Thank God, she never wound up going to the hospital, but I woke up to a phone call of her saying goodbye and get emotional because she calls me and she gives me all her PIN numbers to her cards. She gives me her life insurance information. She tells me I'm in charge of everything to take care of my siblings. We all grown. But to get that kind of phone call in the morning, because once somebody's going to the hospital, you're never going to see them again. So for the people that are out there in the street and they having fun and they still throwing parties, just think about when you decide to go out there just to get that drink or that hit of that blunt, what you're doing is saying F everybody that means something to everybody else. If you only care about yourself and that drug and that party and that one good time, you're selfish. And you know what? Keep that energy somewhere else because there's real people there that want to do change and want to be part of that change. And as far as everybody that's being selfish, talking about when is this going to be over, it's not fair, what's being done to us. Think about the poor people that can't afford to buy a mask, like the man that was saying. It's a lot of things that people are not really seeing that's not televised or publicized. And you're worried about when you're going to get back to work, when you're going to be able to go outside, the summer's coming. What we need to worry about is when there's going to be a cure or a vaccine to help. Then after we find that, then we'll know when things are going to get to normal. Unless there's a cure or a science as to why it's happening, nothing's going to ever be normal. Let's focus on allowing them to find that cure, to find something. And then we could talk about when stuff is going to be to normal. We're never going to be back to normal because had we been studying and practicing universal precaution, you know how many people get on the train and they touch the rails for years since I've been small. I'm almost 40 years old. And nobody ever would, hardly people will wash their hands when they get off the train or sanitize. It comes from us. Us as a human being, we don't think. We're too vain. But that's all I want to say. Just thank you to everybody. You guys on the radio, doctors, nurses, New York City housing workers, and also postal people. They still delivering packages every day, taking the biggest risk because a lot of the stuff is contaminated. Do you know all over Brooklyn, these postal workers are falling like flies? They need the real things too because they're delivering these packages that we need.
And they're delivering a lot of medicine, a lot of medication by mail too.
Yes, a lot of medication, a lot of masks, a lot of whatever they need to do. They're doing their job. And my sister-in-law, she's a postal worker also, and she's a supervisor. And she didn't get out of there last night till after 10 o'clock, putting packages together for this morning. So the postal workers that are left, for the morning to do the deliveries, have everything so that everything could be delivered on time. And she has children, small children, and she's at risk every day to carry something home from a package.
And I want to shout out the Postal Service, the United States Postal Service workers, the UPS, the FedEx. They're delivering all these packages. Yes. Many of them contain medicine, but Lisa, we have to take a short break. But I want to express my condolences, my personal condolences to you.
And good luck to your mother. Right? She's still.
Thank you.
She's still fighting.
I got very emotional there, and I thought your mother. I'm glad she's still with you and still with us. But real quick, what's your final message to everybody?
my final message is, even if you have it or you think you have it, the key is isolation from everybody, constantly wash, warm liquids like they're saying, just practice safety. Everybody should treat themselves like they have it. If you treat yourself like you have it, trust me, you won't get it or you'll survive.
And we can shut this thing down. Lisa, thank you very much. Your family and especially your mom's in my prayers. And thank you very much for calling in. We appreciate it.
Thank you. God bless you. Bye-bye.
All right, thank you. It's just multiple people are having this, being affected by this in like every aspect of our lives.
Lisa is well informed and she hit on all the key points, right? And the key thing here is for us to get back to normal. I think the first mindset is we are never going back to normal, right? This is the new normal for us going forward, right? Being clean, being proactive about healthcare in general, everything Lisa said, perfect, spot on. But to make it in perspective, whenever someone is sick, whether you have cancer or anything, the belief and that encouragement that you have, the will to fight is what makes us strong and actually helps you heal better, right? So I don't want or the listeners, anyone to feel like if someone gets infected, then you're going to a deathbed, right? Let's fight together.
We are going to fight, and we're street soldiers. We're going to fight, and we're going to win this war. Dr. Manny, we're going to get to the calls because we've got a lot of people on hold.
Sure.
But real quick question. I heard a term this week. I want you to explain it to us. They were trying to explain there have been a couple of very prominent, very active, very healthy doctors who have passed away from the coronavirus, and they use this term viral overload. So especially in a place like New York City, when we're around more people, it's very possible we've all been around multiple people with coronavirus and not known it, not just one contact with it. What does viral overload mean?
So correct. So whenever you have an infection, whether it's a bacteria or a virus in general, your body produces your white blood cells, with your immune cells actually fight this infection, okay? And then if it gets to a point where the virus, the number of viruses are higher than actually your immune system is able to fight it, you call it viral overload, which means the virus takes over. It's the same concept in HIV, right? So if you have a low viral count, then you survive today. That's what happens with HIV today. People live longer because you can control the viral load. When the viral load gets higher, then you have AIDS.
So it's the same thing.
Correct.
But if they're exposed to it constantly, as the doctors and nurses are right there being in touch with these patients, does that makes it more likely? The more times you're exposed, the
higher risk of you getting infected.
Right.
Correct.
That's what that means.
Correct. But the viral load element talks about your immune system and the virus itself.
Right. Okay. 1-800-223-9797. Let's go to Alicia right now. Alicia, hi. You're on Hot 97. Go right ahead.
How you doing? Again, my name is Alicia. I'm actually a New York City Transit worker. I actually drive the bus in Brooklyn.
Oh, Alicia, thank you so much for what you're doing, keeping those buses going so people can get to their essential jobs. Thank you very much for that.
You're welcome. It's been like mentally hard because it's like a lot of the people that's riding these buses aren't essential workers, because now that they're free, you get a lot of people just going from one stop to the next, and it gets overcrowded. And now that we're only working at about 60% of workers, because a lot of us are now sick. We already lost about 21 people, just co-workers alone. I'm sorry.
No, take a moment, Alicia. You're good. Take a moment, because what you're helping us understand and what you're expressing is very, very important.
Yeah, it's just like, I guess the warmer climate, everybody just comes out, and people just got to understand that this is a real pandemic going on. It's a war amongst each other, because it's like nobody's listening, nobody's not staying home. It's just a lot. Me, driving this bus every day and just seeing what's going on.
Alicia, let me ask you, go ahead.
Go ahead. I'm sorry.
So in terms of, are you confident in how they're cleaning the buses? Because the MTA tells the reporters that, that they're doing a lot of cleaning with the subways and the buses. Are you confident that they're doing that kind of cleaning and disinfecting?
I'm going to say no. It's not enough. because at points we make these relieves. We used to, they stopped making the relieves that we're out in the street and you have to relieve the next driver to get the bus. They stopped doing that because of the cleanliness. But I'm taking the bus back to the depot to be clean, but this is not, it's not proper cleaning because the turnaround is too much because we have to get the buses back out because now that we're working on a particular schedule, which was Sunday, and you're doing it Monday, Tuesday, Wednesday, the crowd is still getting bigger because the distance between that, the 10 minutes, the next bus comes 10 minutes, it's not like that. The next bus is like 20, 30 minutes and you got a crowd of people. So now you have to still get
because they cut back the service, because they didn't have the same ridership.
Right. So
and then now the buses that do come are more packed with people. What about that,
and
Manny?
even with cleaning, even if you clean, right? The cleaning
Even if you
kills
clean.
was there previously. As a bus driver, people are walking in the bus in real time. People are coughing,
Right.
and you're there, right? So no cleaning will actually protect
So
you.
most of the
right?
time,
And so the
I'm
question
clean.
becomes:
I do
are the
it
drivers
myself.
getting face masks? Are the drivers getting
Like a
gloves?
shield, like a shield right by where the old, right by where they drive. Do you have any kind of plastic, anything like that, Alicia, going on?
We just had the partition that we been having, but we just actually got face masks. They are providing the face mask, and they actually gave us the surgical ones. So now they stepped it up and gave us the N95 ones because we were initially fighting for it because they weren't giving us anything at all. We didn't have anything, no masks, no gloves, and everybody was providing that, amongst each other. So
correct. And if you think
we
about it,
didn't have
Lisa,
none of that.
if you think about it today, if you are sick in a city and you don't have Uber is not cheap. Okay, so we say Uber sometimes, but it's like $30, $40. People are not working now, right?
No,
People are trying to
exactly.
hold on
That's
to
a lot,
money.
right.
Correct. So that's a lot of money. So if you have symptoms today at home and you need to go to a testing center, how would you go around in the city? Do you take a train or you take a bus, right? And you're in the bus with other people, and then you look at transit times
right
now,
now,
right?
the way
Cut
my
down routes, and so
anxiety is,
everyone
I
being
would never
carted
get on the
together. So it's
express.
actually making things worse.
No,
it's
definitely.
It's bad.
All right, Alicia, well, thank you for what you're doing. We really appreciate it.
Thank you.
All
Stay
right, thank you,
safe.
Seth. Stay safe, okay? Thank you for sharing
Thank
what's
you.
going on there. Let's go to Walter right now. Walter, hi, you're on Hot 97. Go right ahead.
Good morning. My name is Walter, and my question is the government doing anything about the gloves, the wipes, the masks that are being thrown on the floor, potentially having the virus?
Oh, that's a good question. Walter, let me ask Dr. Manny about that because somebody else brought this to my attention too. It's like and especially with, people see gloves, like they're just taking gloves off and just throwing them on the streets. Could those gloves potentially have coronavirus on them?
Well, definitely. I mean, you should not pick up anything that you see on the street, especially gloves, right? Especially
Exactly.
gloves, correct? Right? It's like walking down the street and someone has just socks and underwear and you pick it up and you put it on, right? So it's the same kind of concept. Think about it. So you don't want to pick up someone's gloves and put it on. And please, people, dump your gloves in a disposable place, right?
Right.
And so not in the
In a
hospital,
proper place.
correct? In a proper place. In the hospital, for example, you don't dump your gloves in a regular trash can, right? So is it a time where we ask for the city to actually put in some of this biohazard disposable
Right, or
things
some
in
of
the
the
city?
special, right? They have the cans for the for the different recycling in some of the neighborhoods, but at least put a regular trash can out there.
Correct. So people dispose of this right in a proper manner, but that's actually very important.
Definitely. All right, let's go to T right now. T, hi, you're on Hot 97. Go right ahead.
Hi, my name's Key. As of now, what I'm doing, I'm a social worker. So right now, what I'm doing, other than wearing a mask, is trying to build my immune system. So I do stuff like I'll drink green tea and I'll put ginger in it, and I'll eat the ginger afterwards, and I start taking vitamin D, and I'll try to exercise. So pretty much my question is, what are some other things I can do to help build my immune system? That way, God forbid, if I do get this virus, I have a way to fight it, or my immune system's up the part, so hopefully it can fight it off.
All right, excellent question. Thank you very much, T, and I hope you stay healthy. The green tea, there have been a lot of scientific studies about that. I'm a green tea fan. There's a lot of scientific coffee first, but green tea, later on in the afternoon. There've been a lot of scientific studies about green tea, right?
Yes, I mean anything that you do to boost your immune system now is fantastic. Actually, there is last night I was reading this paper where in Germany you actually have physicians looking at ways in which you could boost your immune system. Some of them are looking at the vaccine for TB, for example, right? Like a modified version that actually helps you boost your immune system to help you fight, right? And the whole idea behind this is this, Lisa. The idea is right now it's going to take a while for us to get a vaccine into the market, right? We're talking about 12 to 18 months. That's actually what the FDA and the CDC is actually projecting.
Right.
But in the meantime, we have to do something. What can we do to boost your immune system to put you in a better position to fight the infection?
What can we do?
Eat your juices, right? Exercise, stay healthy, not just stay at home and drink liquor, like we talked about yesterday, right? People smoking. I saw this morning, actually, heading here, I saw people on the side of the road with their mask pulled down and smoking cigarettes. If you had to quit smoking, this is the perfect time to do it, right?
And vaping too, because the vaping it does a horrible thing to your lungs.
Correct, because now you need your lungs to be as healthy as possible, right? So exercising is great, eating healthy is great. Whatever you do normally, to boost your immune system, vitamins are great to boost it. Remember, everything in high doses, moderation, of course, right? Yeah, it's great.
Whatever makes you feel better.
Correct.
And same thing. It's like the things we were always told that we didn't listen to sometimes growing up is like fruits and vegetables, less processed food, not binging on junk. Because the other thing too with the alcohol is I understand people drinking. Liquor stores are supposedly doing record business right now. The alcohol industry is one of the few industries that's really thriving, but it's also when you drink alcohol, then what do you want? You want pizza, you want high fat snacks, you want fatty food, you want fried this, fried that, so it just
and this is underrepresented, Lisa. I think there's something else that we need to highlight in this particular moment, right? So before the COVID-19, we know that in our inner communities, right? If you go there, what do you find? All the fried chicken
our
spots,
inner cities,
right? You get, I don't want to call any particular names of any chain restaurant, but it doesn't matter. But I like unhealthy food as well, right? Fried foods and all this stuff, right? Everyone loves it, right? Ice cream and everything else.
It tastes better.
But you know what happens is, and we don't worry about the air condition. Look at the Bronx, as I mentioned earlier. Right. If you look at things like diabetes.
3 times. You're saying Bronx, 3 times the rate of COVID-19 deaths as any other borough in the city.
Correct. Even though the highest number of infections are in Manhattan, but the deaths are taking place in those communities. Why? If you look at even New York City and globally, majority of people that died from this had other comorbid conditions, especially diabetes, heart failure, hypertension, right? And so what does it say about our society in general? We have to be more proactive about our healthcare in general going forward, beyond the world of COVID-19. And this whole concept of something called predictive medicine, right? Be able to understand your health and your risk for having disease and doing things that mitigate your risk for disease. So it's beyond COVID-19. If you are healthy as a society and we are well off and we all take care of each other to make sure we actually are healthy, in the long run, we can all fight these things and survive.
And be much better off.
Correct.
All right, so it's got to be, this is undoubtedly going to change the way that we look at health and all of that. Let's go to Stephen, too. Stephen, hi, you're on Hot 97. Go right ahead. We're taking your calls at 1-800-223-9797. Go right ahead.
Hey, I just want to say I love your segment. And just to move on, chime in on what everyone's been talking about, is that my best friend was a postal worker, and last Monday he passed away indirectly, I would say. He wasn't sick. He was a germaphobe. He's a mailman, and he said to me while we were talking on the phone that the packages were getting heavy and the stress flowed, and I just don't want to get into it, but indirectly it led to him. Basically, my main message to everybody is, the audience, is if you're someone who is not stressed, maybe you're in good shape, there's someone in your life who's vulnerable, and vulnerable by mean that they can't accept the new normal. And I would just say, let's extend the helping hand of love, social distance, but don't isolate. Give someone a call. You don't have to go to their house. Just give them a call if you have a grandma that you haven't get in touch with, and stick together. Don't let the social distance make everyone close in to a quarantine.
You know what, you said that so beautifully. That was real. That really sums it up too. Is just really reaching out to people any way you can.
Show the love.
And maybe that word social distance is scary, right? It's a physical distance, not social distance. But let's not disconnect from being humans.
Right, physical distance. We're going to use that physical distancing term on Street Soldiers.
Yeah.
So, Stephen, you think that the whole pressure led to your coworkers?
His friend.
And I'm going to tell you, my best friend's mother tripped and fell. Now, she was a little bit old and she wasn't sick, but I think that she's a tough woman. This never happened before. I think that she was home alone and she was stressed. So I'm just going to say with one blanket statement, I have a theory that the cure to this is love. and that boosts the immune system. So if there's anyone you know in the hood, especially a lot of people talking about, I was worried because my girlfriend's in Shanghai, so I knew about this coming a month before anybody. I was telling my girlfriend to stay home when this happened in Shanghai. So, but I just know that it's Chinese people really stick together. We got to stick together as a community, as American citizens. We can't always just look to the government to do everything for us.
We can stick
if you
to
see
there's
a
a lot we
mailman,
can do. Exactly.
yeah, if you see a mailman, this is just one last thing I want to say in dedication to my brother who passed away. If you see a mailman who's not wearing a mask, you know what I mean, and you have an extra one, you know what I mean, just don't hoard it. Give it to him, okay? And maybe even tip him $20 because if you're one of those people that you need those packages for the medicine and stuff like that, show that love because that love will go a long way. It'll fight this virus if we let the load off of the people around us in our community, not be selfish at this time. It's dangerous to be too selfish right now.
All right, Stephen, thank you very much for the call and some wonderful thoughts there about what we can do about love.
That's a great initiative right there, actually, because if you went to the stores in January to buy a face mask and they were all gone, right? There are very few people that have all the masks, right? And they're not
Right.
sharing, they're just hoarding it.
Right.
But the whole concept here is for us to actually get back to our new normal, or
Right.
whatever normal is. It's a community effort. It's not one of those things where you by yourself, you have all your masks and you're safe because guess what? Someone else you're going to get sick. Someone else might come back and infect you.
Exactly.
Correct, right?
We really are all in this together.
We are in this together, right? And the more we have more people that have fought this infection and have antibodies against it that can protect it, it's called this herd mentality, this herd immunity kind of thing, where one person gets like infected, and then as a community, if we've all been exposed and we get better at this and we work at this together, you can't just have all the masks and all the sanitizers at home and all the toilet paper and all the groceries and try to sleep by
Right.
yourself. Let's share.
Let's share.
correct.
All right, we're going to share some more knowledge, and let's go to Toya right now. Toya, hi, you're on Hot 97 with Lisa Evers and Dr. Manny. Go right ahead.
Yes, hi, good morning. I'm a healthcare worker from Connecticut. And of course, I'm sitting here watching the news with New York, and I live pretty close. So you have all these job offers for $100 an hour. But Dr. Manny, with TB, all these people are placed in pressurized rooms. And in New York City, they're setting up all these, in the centers, all these tents and healthcare situations, which none of them are properly ventilated. So how do they expect people to volunteer to come to your state to help when down south in Louisiana, everything is set up properly where they have ventilated hoodies and suits that goes on the nurses and doctors. And they don't have that in New York State. And they keep requesting reproduction of contact precaution equipment when we need droplet precaution equipment.
All right, let me get a opinion. Toya, thank you very much, and thank you for the work you're doing. What about what she's saying? Because we hear this PPE term, this personal protective equipment. Is it enough? Like even at the best case scenario, is what they're providing enough, or are there more high tech things that people need?
There are more high tech things if you're work in a hospital where you know for a fact you have patients with that are infected with COVID-19, right? And what the caller was referring to, these pressurized rooms. Interestingly, when I got in the studio this morning, Lisa was showing me a picture
And said, "What is this?"
and she showed me what is this, right? And I believe that's a hospital in New York City.
Yes, it is a New York City hospital. It'll be posted on my Instagram later on today.
Correct. Yes, we check Lisa's Instagram later, and you'll see this picture.
And these white tubes coming out of the
and
windows.
white tubes coming out of the windows, and she goes, "What is this?" And I'll just explain to her what those tubes did, right?
We tell everybody.
So they're pressurized tubes, where basically sucks out air out of the rooms, right? So they're pressured. So if you look at in the hospital rooms, they'll naturally have windows open, right? And you have viruses in the air. We know about this. And so initially we did not think this was airborne, right? So we on TB, we know it is, right? So in this case, we didn't. And so what is happening now is you see a lot of these tubings being put into
Outside the hospital windows
to suck out the air. That's basically what that does.
But what about what she's saying? She's saying that there's also suits that some people wear that have those kind of
Yes.
a whole suit, like a hazmat suit.
Yeah, correct.
Like a biochem warfare type suit.
If you look at any other country in the world that is managing this, right? If you look at China, look at Korea, if you look at Germany, right, Italy, You see how the healthcare workers are dressed is nothing close to what our healthcare workers are dressed as.
No, they're like in a whole suit. They're not in these paper tie-back gowns like that just almost looks like something you'd wear for a quick cookout or something.
Correct. So I think
They're like head to toe, almost like a biohazard type of
that's
outfit.
how a healthcare worker should be dressed. I mean, in this, right? To make sure they're safe and they're able to work longer instead of making them sick and dying.
We're taking your telephone calls at 1-800-223-9797. Very emotional morning. A lot of people calling in just kind of worn out by the whole thing on the front lines there.
I think we're all breaking, right? All of us, right? I mean, this is society is completely different today. Just walking around, there's no air of excitement. People are losing their jobs. People are losing loved ones. People are scared of actually getting infected with this. It's scary.
It is scary, but we will get through it. That's why we're doing the show. That's why our Hot 97 management gave us the opportunity here to do this special 2 hours live. We're on live Saturdays from 10 to 12 noon and Sunday mornings from 7 to 9. Dr. Manny taking your phone calls as well with his expert medical advice and safety advice for everybody. But there's going to be another side of this. We're going to get through it. This is going to be a very rough week by all estimations. And so far, the estimates have been pretty accurate in terms of what we're going through, in terms of number of cases, in terms of severity. So we have to mentally be strong as well, mentally strengthen ourselves and understand this is not going to always be the way that it is all the time. We're going to get through this. Right now, you need to keep yourself healthy, keep your loved ones healthy, and do everything you can to try and minimize contact with other people so that they can get a handle on this.
Correct. But on the bright side, I'm not saying of course, every death is heartbreaking. But on the bright side, if you look at things in general, to put it in perspective, okay? So in Germany, you have about 92,000 cases of the virus, and the death rate is about 1.4%.
And
right?
what does that mean? That
1.4% of people that get infected, that actually got infected,
actually died.
1.4% injury.
So the percentage of deaths is less than 2 for every 1,000?
Correct.
Is that right?
Correct.
Well, that's a lot of math for me early in the morning.
To
Okay.
put it in perspective, right? So,
without my calculator.
Yeah, correct. Yes.
All right. But see, people need to keep this in mind because we're hearing these numbers of cases. This is a very important point you're making. The numbers of cases we're hearing now are in the tens of thousands, even over 100,000. So we're hearing these high numbers of cases, and you're saying that the death rate is under 2%, meaning two people in Germany.
Correct. So
do you expect it to be similar here?
Yeah. So I have the numbers here. So
Okay.
in Germany, you had 92,000 people that actually have like positive cases, and then you have about 1,295 deaths, which is about 1.4%, right? In Italy, where we hear a lot of things coming out, and we're scared of it, like what's happening in Italy is pretty
Right.
bad. That's at 12% in Italy. In Spain, France, and Britain, 10%. In China, it's 4%. In the United States, 2.5%. Okay, so it's pretty low here. I mean, it's not ideal, yes,
Right.
but it's much lower than what's happening in Italy, right? So yes, we have a lot of cases in New York City, for example. We have tons of people that tested positive because we also do a lot more testing. Okay, but when people actually go to the hospital, it's not a death situation. Right? People do
So
survive.
basically roughly 90 in the United States, roughly, because we're still, this is far from over. It's safe to say more than 90% of the people who test positive for coronavirus will survive it.
Correct.
That's correct.
Correct.
All right, so let's keep that in mind because, and I think that's really important too, because everybody is now becoming obsessed with numbers,
Right.
with these numbers, and these numbers are huge. And we're talking about 12 deaths an hour in New York City, which is a scary, scary number. But let's keep in mind what Dr. Manny's saying: more than 90% of the people who are positive, who have coronavirus, will survive, okay? So let's keep that in mind. And the way we can ensure that more people survive is by doing what we need to do in terms of protection and in terms of, in terms of physical distancing and just following the basic rules. All right, let's get back to the phones, 1-800-223-9797. Let's go to Bobby right now. Bobby, hi, you're on Hot 97. Go right ahead.
Oh, how's everything going? I love the topic you're talking about.
Thank you.
Thank you. The thing I don't understand, and especially where this originated from, I don't understand why the animal markets and the factory farms, the slaughterhouses. I don't know why these markets aren't shut down permanently. And I hope that people, because I'm a vegan, and I hope more people consume less animal products, man, because it is an absolute disgrace the way these animals are raised and reared. And to me, and it's just one other quick thing, because they show live footages, and the Chinese still have not closed all these animal or wet markets, and now they're extracting bile from black bears.
Okay, Bobby, let me just. We're getting into like a scientific thing. I want to get Dr. May. The coronavirus came from animals, right?
We don't know.
Or we don't know. I mean, that's what you read.
We think it came out of the meat market out of Wuhan area from bats, right? So that is that's what we could localize it to, like from that area, right? But it is in medical literature that a lot of this kind of cold viruses could transmit from animals to humans, especially birds.
All right, so like some of the like what we call the bird flu, right?
Yeah, correct. Right, and I think actually I read some articles about, like in China, for example, putting a ban on the killing and eating of certain animals like dogs, cats, or other things, right, in particular regions. Yes, so I mean, it's great. I'm an animal rights person and support that, but we just go what the science says.
Yeah, we have to go with what the science says. Okay, thank you very much for the call. Let's go to Joshua right now. Joshua, hi, you're on Hot 97. Go right ahead.
Morning.
Hey, good morning. What's your question or comment, Joshua?
Well, this is really not a question. I just want to raise concern about us tow truck drivers out here in the front line as well, towing, all these emergency vehicles, police, ambulance, fire department, and any other vehicle that needs to be towed from a location and stuff. I just wanted to, shed light that, us tow truck drivers are out here on the front line. We work in 6 days a week. We're out here again on daytime, nighttime, and everybody consider essential workers, grocery store people, etc. But us tow truck drivers are out here as well. I just want to shed some light on that. I'm out here towing in the Bronx, which is really difficult and hard. I come across a lot of people that's wearing masks. I don't know if people is infected or not. People do have to ride in my truck when their vehicle is disabled, So I just want to know what safety precautions do I have to take. And stuff like that.
Are you wearing a mask when you're working in gloves?
Well, while I'm driving with nobody in my truck, I wear the blue mask. When I'm outside in contact with other people, I wear my blue mask and a KN95 over my blue mask. I also wear gloves, hand sanitizer. I spray my truck down, disinfect it.
All right, good. Dr. Manny, what else can he do? Thank you for the call, and thank you for the work that you're doing, Josh.
So great. Yes. So
he sounds pretty well equipped.
Yeah, I think you're doing a great job, and you're educating yourself, making sure you're protected. So definitely, if you have someone in your truck, you definitely want to put on a face mask. And I'd like to give a shout out to all the tow truck drivers out there. And yes, and I think every single person that is out here, helping us, even those that are on the front lines and those in the back end, that make sure we all function as a society. That's very important.
All right, so there's really pretty much nothing else. Well, can he spray the inside of the cab with like the disinfectant spray too?
I'm definitely sure he's done that, right? So
all right, but that's not. It can't hurt.
No, it can't hurt. You want to make sure you clean your car.
I'm trying to justify me going down the hallway, the staircase,
the Lysol?
with my can of Lysol. Like, all right, 1-800-223-9797. Let's go to Rich right now. Rich, hi, you're on Hot 97. Go right ahead. Hey, Rich. Okay, I think we lost Rich there. Did I not hit him right? Okay. Hey, Rich, sorry about that. Hi, Rich, you're on Hot 97. Go right ahead.
All right, how you doing, Lisa?
All right, how are you doing?
I'm a Lyft driver, and I'm out here Frontline, and I have a construction company, so I had 250 boxes of K95 masks, and that's what I've been giving out to these doctors and nurses. Also, I want to let these drivers know, because a lot of these nurses and doctors are telling me that drivers are declining their call once they get there and see that they're taking them to a hospital. I mean, basically, I want to tell my fellow drivers, strap up, man, and mask up. Let's get these people to their jobs so they can do what they got to do so we can get over this. My mom is a nurse. She's Frontline. The story she's been telling me, she's seeing me, she's 50 years old, and she's saying that she might have to go into therapy after all of this, and people are dropping like flies in New York. And basically, that's what I'm trying to get these drivers to know, man. Let's get these people people to work. I'm donating these boxes. Every doctor and nurse I pick up, I'm giving them 5 to 10 boxes of these masks so they can take into work with them, because they're telling me they don't have none. They have to either reuse the same mask all day. And as much as I can help, man, that's what I'm trying to do. But my drivers out there, let's get these people to work. Do not decline them. I picked up a nurse this morning. She told me, can we please go pick up her coworkers, because they were waiting for over 40 minutes. Hello?
Yeah, go ahead, Rich. Yeah, I'm saying they were stranded. They were waiting and waiting
They
and
were-
waiting.
Exactly. They've been waiting for over 40 minutes. Can we pick them up? I picked them up free of charge, dropped them all off at their job. I mean, as much as we can help out here, that's what we got to do just to get through this all together. Because I see a lot of people hanging out, and it is horrible out here, man. It's horrible.
Rich, and thank you for what you're doing, and also really important too is thank you so much for your message, because there is a lot of fear out there. We all have to do our jobs. Every industry and every category has people that are like, okay, I'm not doing this, I'm not doing that, or whatever. But if it's your job and it's essential to keeping this going and helping us win this war, we need to be real street soldiers. We need to just get the boots on. And that's it, and deal with it. Protect ourselves as best we can and move forward, because that's the only way we're going to get to the other side of this. Rich, thank you so much for what you're doing, and for especially given that's the last stress that one of these healthcare workers that's getting 4 hours sleep, turn around and then go back to work for another 16-hour shift.
2 hours of sleep and going straight to work.
Yeah, and going back again.
And we'll put ourselves in this situation, right? So imagine if your own mother or aunt or wherever got infected, right? And they needed a ride. Would you just let them there because you're worried about just protecting yourself? Like I said, to get rid of this problem would take a community effort.
I've been getting calls, and my whole team, Lisa, and our Street Soldiers team here, we've been getting calls and texts and different messages from people who have certain things they want to donate to first responders. They want to donate to essential workers. And what I would ask you to do is please email us Street Soldiers, one word, Street Soldiers at hot97.com. Street Soldiers at hot97.com. And we will try to connect you with people on the ground, because that's how we do it with Street Soldiers. We're all about direct aid and direct help, real time. We will try to connect you with those first responders or those people that can actually use the help and get it to them right away. Like masks for drivers, that's an important thing, and for postal workers and for the delivery people, all of these types of things, as well as, of course, for our nurses and our hospital and healthcare workers, our home attendants, our people who are working with the disabled, who are very close to them and are just not able to get the protection they need. So if you want to pitch in some way, we will try to put you with somebody that needs what you're trying to offer, whether it's food, whether it's cases of water, whether it's masks, whether it's gloves, any of that type of thing, cookies, whatever it is, because these people, especially our hospital workers, you heard Brittany earlier. She just came off the shift. She didn't even have time to eat the whole shift, and that's how it is, and that's what they're doing. All right, let's get to the phones right now, Dr. Manny, 1-800-223-9797, and let's go to Nikki right now. Nikki, hi, you're on Hot 97. Go right ahead.
Hi, good morning.
Good morning.
I myself, like Brittany, am just getting off work. I work on a 911 truck for one of the hospitals locally here in the Bronx, and these calls are outrageous. We have no time to eat whatsoever. Like the tow truck driver, he was wondering a solution to cleaning his truck as well when the patients or customers get in and out of his truck. We use the 1 to 10 bleach solution on our trucks.
And what is that? What is 1 to 10? That's 1 part bleach to 10 parts water?
Yep.
Okay.
Yep. And we wipe it down, we let it air dry, and we go on about our day, because we come encounter with so many people that have this, that really, with the hospitals, if they tell you that you're positive for it and they tell you to stay home on quarantine, stay home on quarantine. There's nothing else they can do. The only way that they're going to be able to really help you is if your oxygen saturation level plummets. and you basically feel like you can't breathe at all. Other than that, they're going to tell you to stay home. You have the medication, you have the Tylenol to reduce the fever.
And that's it. And Nikki, in terms of supplies that you have, do you have what you need to protect yourself as you're going into these apartments and homes?
We don't. We are limited on supplies. A lot of the companies are actually having us reuse our N95 masks because we don't have enough supply. We don't have enough high-risk kits, gowns, hairnets, things like that go in the kits, boots, like the booty covers to cover our boots to go into these patients' houses to protect ourselves or even our family. I find myself when I get off work taking off my clothes in front of my door, leaving my shoes outside my door because I'm not trying to bring it in my house.
I know. I think we all need to be taking off our shoes when we go in the front door.
But look at an interesting piece here. We have,
Nikki,
and we have workers in the hospital that leave, right?
Right.
And they are taking care of these patients. And they don't have protective equipment, right? Nikki just told us exactly, if you show up, even if you're positive and you have fever, they don't have space for you in the hospital, right? You have to go home until you have like oxygen saturation.
So you've already
issues.
exposed yourself to a bunch more people.
On your way to the hospital and then going back, I'm sure there's no transportation for you. I mean, whatever
Right.
the case, right? So if you're taking the bus back, right, which exposes like the bus drivers, right? Or you,
And the buses are crowded.
Correct. Even if you walk or whatever happens, you have to grab some food. Imagine going back home and then telling everyone at home, hey, I'm just positive for COVID-19. And so if the healthcare workers don't have protective equipment, how do you expect people at home in real time to have protective equipment?
Right.
Right. And so not everyone lives in a massive mansion, right? So people might live in a one-bedroom apartment they're sharing, and you show up. And so what happens? You start in the corner of the house and you're coughing in the house.
Right.
So I think this is something that we should be more proactive about this, to give out gloves and everything, PPEs, and to every single person in our community.
No, everybody. All right. Nikki, thank you very much for what you're doing. We really appreciate it.
Thank you, guys.
All right. Hang in there, okay?
We'll try.
All right. Please do it.
Doing the
And
best.
stay in touch with us. Give us a call next weekend. Let us know how it's going, okay?
Absolutely.
'Cause
Thank you so much.
All right. No, thank you really for what you guys are doing, because you're coming into people's apartments and, houses at the most critical moment, and at moments when, they're the most panicked and most upset. And my hat's off to you, because it's a lot to deal with, and you guys are the best. So thank you so much for the call. Keep up the great work. And Nikki, check back with us next week. Let's see how things are going. Let's go right now. 1-800-223-9797. Let's go to Gio. Gio, hi, you're on Hot 97. Go right ahead.
Yeah. Good morning. I just want to give a shout out to all first responders, NYPD, firefighters. Me, like myself, I'm like Josh. I'm a tow truck driver. I work on the highways for towing for NYPD, and I would tell Josh, do what I do. I always wear my gloves. I spray my truck with Lysol every time. Every time I'm at a scene. It doesn't even matter. My boss doesn't even want us putting people in the trucks. People, you got to stay home. You got to stay home. I mean, it really sucks, but you just got to stay home, man, because I'm seeing people in parks. I got friends that work in the parks department that they have to go in there, and these people are still out there playing basketball. I mean, you don't get it. It's a sad thing, Yeah. My wife, she's a ACS worker, and she's a first responder. She has to deal with kids and
then go into
these families.
into the homes, right?
Yeah, she has to go into these homes, and she's at a point where she has to video chat sometimes, just because she doesn't want to bring it home, and I don't want to. I'm just getting home from work. I work overnight.
Wow.
And I'm just getting home I'm walking in my door as we speak, and it's dangerous out there. It's really dangerous, and God bless you guys. God bless Hot 97. You guys are the most informative radio station and I listen to them all. And Hot 97 is the most informative radio station you have out there right now. You guys are a blessing. NYPD, we love you. FDNY, EMS, we love you guys. Nurses, doctors, without you, we're not gonna be here. ACS workers, keep up the good work, and
home
and
attendants,
be
all these
strong.
home attendants and health
Home
aides
attendants, all of them,
that are going into
guys,
these people's homes.
Yo, we got to show them more love. We got to show them more love.
All right, we'll
Lisa,
share.
Doc, you guys have a wonderful day. I need to get some sleep, but
Thank
you know, God bless you guys.
All right, Gio, God bless you, and thank you so much. Thank you for so much for the call and for the love. Let's go to Tommy right now. Tommy, hi, you're on Hot 97. Go right ahead.
Hey, what's up, Hot 97?
Hey, Tommy, what's your question or comment?
My question is, I keep hearing about scarves. I wear a scarf around my nose, and I think it's very effective. I mean, I haven't had any problems. What does the doctor think about a scarf? Can this compensate instead of wearing a regular plastic, like a filter or
like a plastic mask? All right, let's get him to talk about that, because I'm seeing it, and I saw yesterday too, a lot more kind of homemade masks. People had scarves. People roll up bandanas and put them around their face. Dr. Manny, it's given that you can't get, I mean, a real N95 mask should be left just for first responders and healthcare workers, correct?
Correct. So
but not that you can get one anyway, but.
Correct. So every mask you have is just based on different kind of layers, right? And what it prevents from coming through, right? So of course, if you had, so anything that could block your nose or prevent any kind of like dust particles or viruses or bacteria, it's better than not having anything, right? So if you were to look at filtration levels and you say, which is better, is it better to have a mask on or have a scarf? So of course, the mask is much better, right? Because it has multiple layers and it could filter things better, right? Then it's like a winter coat, right? Would you put on
right, as opposed to a windbreaker?
Correct, a long sleeve, a windbreaker, or a winter
hoodie,
coat.
right.
Correct, based on the temperature, it's kind of different, right? But today we have shortage of N95s, so it's preferred that healthcare workers who are at higher risk and the front lines should get those first. And so the recommendation, even from the CDC and the president, is if you have a scarf, you could put it on, right? Homemade.
It's better than nothing.
It's
saying.
better than nothing. Correct. It's
better than nothing. So that's the answer there. It's better than nothing. 1-800-223-9797. Let's go to Omar right now. Omar, hi, you're on Hot 97. Go right ahead.
Yeah, how you doing? It's good to, I guess, vet from a nurse. I've been a nurse for like 24 years. Worked in, a lot of different rehab facilities, and this virus has really got the nurses very nervous to come to work. It's a lot of the residents that are carriers, and sometimes you're working with them not knowing, if they have the virus or not. The equipment's another thing. You got to use the mask, and you got to keep the gowns in the rooms and stuff that of the patients that you're taking care of that have the virus, and if we had a lot more supplies, like the covers for your sneakers and the hair nets and goggles. If we had a lot of the quantity, and you wouldn't have to reuse and wash it.
No, absolutely. Omar, let me just, because we're almost out of time for the show. So you work you work in a nursing home?
Yeah.
All right. Let me find out from Dr. Manny what he has to say about that, because first of all, thank you for what you're doing, and extremely dangerous. We saw in New Jersey a pocket in a nursing home, a lot of cases, and then the nurses and the nurses' aides were coming in there, and they weren't being told which patients were positive for COVID-19. Then they find out there were 6 in this one particular nursing home there, and not given any type of protection. Nursing home, there's a lot of nursing home workers, and also too, because people, regular staff are getting sick. People are being, coming into these jobs that don't usually work at that particular facility. What do you say to them, to these nursing home workers?
I think, first of all, the employer should make sure that these people are safe, right? Be on the front lines. I mean, that's the reason why we see these numbers increasing, right? We are in a pretty bad spot as a country dealing with this, right? If you look in places like Louisiana, Florida, right? People didn't take this seriously.
No.
Now it's getting worse. And so I think we need to take this thing seriously, especially for workers like that in a nursing home. Those patients are already at high risk, right? They have comorbid conditions.
Right.
Can't take care of themselves. That's why they're there. and you show up, and then you're not protecting the employees, and they're going from room to room and seeing patient to patient. That's why you see these clusters of this outburst.
In the
They're
nursing
fine.
home.
Correct. So those patients, those workers should be protected, and I think that's the least that we could do.
And they should be tested too.
Correct. You should be
Like
tested and
regular
protected.
health, because also too in the nursing homes when they're dealing with with these elderly patients, many of whom are sick. It's physically hands on. This isn't just like here's your medicine, here's your cup of water, swallow these pills. It's like they have to help them eat. They have to basically help them do everything.
Correct.
Many of them,
correct.
not all of
And
them,
I
but
think
in some of the more intensive care ones.
No, correct, Lisa. And this is a right position in which we should rethink how we do things, right? And so, one, I think universal testing will be the ideal situation.
Period,
where we can.
end of story.
Correct. Then we know those are at risk, and we don't have to wait till you have symptoms and fever and can breathe before
Right.
you start intervening, right?
Right.
The earlier you actually identify and start treating people is way better than waiting till they get more, way sick. To do
Right.
it. I could bet you that today we have people at home probably listening to us right now that probably have fever, but they're waiting for the next symptom to show up. I'm waiting for the next symptom, right? Until, wow, I can't breathe and I have pneumonia. Then I go to the hospital.
Right.
Right. So we want to catch people early and treat them early. That's the best practice of medicine.
The best way to do it. Okay, let's go to let's go. I think it's Marcy or Margie. Let's go. Okay, or Mark. Hey, Mark. Is it Mark or Margie?
It's Marquise. How you doing?
Oh, Marquise. Okay, great. I saw the Q there, but it looked kind of like a J, so a G. Marquise, thank you for your call.
Thank you. My question is, I see a lot of them using their employees to clean up the place, and it's exposing them to getting sick. I want to know how come they don't have hazmat crew teams come in and clean the place like I see them doing in other countries. America is doing nothing at all but counting bodies. There's no hazmat team going in making cleanups. That's my question. I want to put that out there to the
No, I think you
administration.
should put out that. Okay, let's put it out there to Dr. Well, we can put it out to Dr. Manny right now. What about that? Because we see power washing in China. We see all kinds of hazmat type cleaning.
Well, I don't think that we're taking this as serious as we should, right? I mean, you see this.
Even still,
yeah.
Right.
I think there's a lot more things that we could do, to protect ourselves. Does it hurt, to clean the streets and spray buildings? No, it doesn't hurt, right? But a lot of times you have to look at the cost-benefit analysis piece, right? And so it doesn't mean we just blow money out just for the sake
But
of blowing things up.
shutting down places of business, which many are doing, which many are doing, when somebody tests positive, and then they do a deep cleaning.
They do deep cleaning, but I think that all essential workers should be tested? That should be a bigger question of debate, right? If you're an essential worker and you're going out there, should you be tested in general, right? To know if you're at risk, then maybe you get pulled out instead of you going out until you have symptoms, right? Because you might be going out and then infecting other people, and then later things get worse. So as testing ramps up, I wonder what the guidelines would be around that.
Let's hope that it does. We got time for one more caller? Okay, we got time for one more caller here. Let's go to Vic right now. Vic, hi, you're on Hot 97. Go right ahead.
Hi, good morning. Right. So I work at Amazon, or one of the Amazon facilities, and it's a pretty large facility. They do send us text messages every day to let us know basically that they're confirming cases every day, but they're not giving the exact amount. My facility holds 4,500 people. We are the biggest facility Amazon owns. We are in New York City, Staten Island. My concern is, how do I find out actually how many people in that building have the coronavirus? I have to go to work. I need my money. If you voluntarily take time off, they will not pay you. That's my question.
All right, Vic, thank you very much for the call. And big shout out to all the Amazon workers, too. We didn't mention them when we were talking about the packages and the deliveries, because Amazon is the only way a lot of people are getting the things that they need at this particular time. And Amazon has said that they're taking this very seriously. They have their whole COVID-19 thing on their website. But when you have these big facilities like that, Dr. Manny, that's a concern. And also too, it's impossible now to find out really too much information about. We see these red dots of where hotspots are, but Is it down to like the micro level, like this street has so many cases or that street has so many cases?
No, correct. And don't forget, there's also a lot of stigma associated with this, right? And so it'd be much easier to call people out by name and say, in this department, they had 3 people. And then you could tell the 3 people are not at work. So you know exactly who those 3 people are, right? And there's still privacy in terms of health data, right? And what you can expose.
Well, that's the other issue too.
Correct. And so from the company side, I can understand why they would not necessarily say how many people by given number. But then overall, you can find out how many people inside the island have the disease, but not specifically in that location because of that. But I personally believe that the same precautions that we've discussed earlier. I mean, for people, washing your hands, right? Keeping that safe distance from people, right? Having a face mask and gloves. You should have that mindset of I am infected and the person I'm speaking to, I'm next to, might be infected. That should be the universal mindset, right? To protect yourself, regardless of what situation you are in. You should maintain that.
All right, and then just final word, quick word from you on how people can deal with, because we're gonna have a rough week.
Correct. We're going to have a rough week, but we're all in this together. I think the mindset and that I think we go into this week thinking is, listen, we are a community. If you have, face masks that you're hoarding at home, please share with your neighbors, right? If you think that your postal worker, should have a face mask and you have some extras at home, please do give them some. They might not be wearing it because they don't have access to it, right? You have extra gloves, please do share, right? If you have food, share with your neighbors. A lot of people are currently unemployed.
And there's a lot of we didn't even talk about that, the food pantries that are closed and people needing food.
Correct. The people need food. Even people on unemployment, they might not get their checks on time, right? And then if you get your check, you might not get groceries on time. So let's share and support each other.
Right, and it's going to be rough, and we'll get through it together, as Dr. Manny said, as a community too, and those stimulus checks too. It's if you have direct deposit, you can expect that pretty soon in a couple of weeks. If you don't have direct deposit, it could be one of those check is in the mail and who knows when it's going to get to you. So we really need to be reaching out to people, be checking on our neighbors. If you have things you want to donate to particular groups or particular causes or particular aspects of this pandemic, please email us, streetsoldiers@hot97.com. Everybody's overstressed, everybody's overworked, and we're going to try to match you up with the right place so that those supplies, whether it's food, whether it's masks, whether it's gloves, whether it's non-perishable food, cases of water, energy drinks, whatever it is, we are going to try to make sure that gets to put you in touch with it, because we don't have a delivery system here. We're a radio station. We have a lot here, and we've got great people, but we don't have all those kind of vehicles and stuff. But we will try to connect you with the people that can get it right to where it needs and, where it needs to go, and people that will use it directly. So that is streetsoldiers@hot97.com. And I'm going to be trying to put a little inspirational I have an inspirational message every morning on my Twitter, @LisaEvers. I'll be giving you a little Instagram report every day. Get a little more consistent with that. It's been a lot of work at Fox 5 News for us, as you can imagine, a lot of shows that we're doing. So check that out too. But just follow me, Instagram, Twitter, Facebook. I'll be posting whatever information that's verified, that we can verify and is helpful. We'll be putting that out there for you.